have to say, Sam, that I was reading a story this week, a dentist who was going through schools in Norfolk, and he said that something like 22% of the children he saw had never seen a dentist, and they were 6 years old, and that many of the children didn't even have a toothbrush in their house.
Wow.
As a dentist, I mean, I'm shocked by it, but as a dentist, what is that going to mean for the health of people's teeth in the years to come?
Yeah, that is a very concerning statistic, isn't it? I mean, you'd expect 100% everyone to have at least seen a dentist or at least have a toothbrush. So that's interesting. I think the important thing there is education, isn't it? We have to do whatever we can, and the dentist going into the schools is a brilliant step. You know, that's something that we do as well, and that can allow the kids to then go home and talk about the dentistry, and if the parents are more educated, that's also good too. So those sort of initiatives on the grassroots level is probably a good idea.
Sorry, I have to come off the back of that and ask you, does that mean, you know, that in the next however many years we're going to go back to the bad old days when in your 20s and your 30s you had to have false teeth?
We've always, in the UK, had quite a high statistic of young people having to have lots of teeth removed. Under general anaesthetic in Europe, we have the highest rate of clearance, which means taking out baby teeth, which is not great. So whatever we can do to try and help that, because you're quite right, it's a ticking time bomb. You know, those teeth will eventually cause problems.
Why aren't we more concerned about oral health? Because it's not actually just about our teeth, is it? I mean, oral health can be linked to general health.
Yeah, there are a lot of studies out that do show that certain diseases, such as heart disease and gum disease, have various links. It's a little bit... there is a lot more research that is needed, but what we do know is the risk factors for certain health issues are actually the same as, for example, gum disease. So if somebody is suffering from gum disease, the certain factors that might be at play are diabetes, you know, inflammation, obesity. Those are issues that actually are the same risk factors for gum disease. And so if we can control smoking, you know, have a healthier lifestyle, look after ourselves, will also help not only our general health, but our oral health as well.
But isn't one of the big problems that it's only something like 50% of the population that have got access to an NHS dentist? And going to a private dentist for many people is just economically prohibitive. So isn't this where the government needs to step in and actually say to the Royal College of Dentists or whoever, you know, come on, we've got to have more national health dentists to protect our dental health?
And we have a national health crisis generally, but definitely in dentistry. And it's been going on, and it's been getting worse and worse. And actually what's happened is after the pandemic, and I hate to bring up that again, but it's still, we're seeing the knock-on effects. And it's actually the ability to provide a high quality of care on the NHS is getting harder for NHS dentists. And that means that so they're suffering from burnout, having to see so many dentists, so many patients in a day for one dentist, and then there's no ability for other patients to get in as these numbers of dentists are dwindling. They're either moving into the private sector to be able to provide the care they want to, or, for example, we recently learned that Bupa, a corporate provider of NHS and private dentistry this week, is closing 85 practices across the country. So it's only getting worse.